All right. Question 10. Which of the following best describes a primary source of elevated serum palmitic acid levels in the context of metabolic disease? Now, what do I mean by this? So, palmitic acid or palmitate, this is the saturated fat that everybody worries about. We worry about consuming it. And we know from observational data, epidemiological research, that people with increased levels of palmitic acid in their blood have an increased rates of mortality. They have increased rates of metabolic disease, diabetes, so on and so forth. So the question is, where does this saturated fat, where does this palmitic acid come from? So option A, it comes from foods like red meat and dairy products, which are rich in palmitic acid. Does that make the palmitic acid levels in the blood go up? It comes from increased de novo lipogenesis in the liver, which turns carbohydrates into palmitic acid. Or C, impaired beta oxidation of palmitic acid in mitochondria. Or D, enhanced absorption of palmitic acid from plant-based oils. Now, the answer is B. The body actually can convert carbohydrate into palmitic acid, and this has been proven to be a more significant factor in rising palmitic acid levels than the direct consumption of palmitic acid itself. This is an incredibly important point. This study fed subjects on either low fat, high carb diets or high fat diets. And after 10 days, there was a significant increase in palmitate levels in the low fat fed subjects. In effect, they found higher levels of this saturated fat in the people who were consuming low levels of that saturated fat. And here's why. Excess dietary carbohydrates can be directly converted into fatty acids via the process called de novo lipogenesis. This graph is from an overfeeding study where subjects consumed carbohydrates in excess of their actual needs. So you can see, despite consuming excess carbohydrates, the rate of glucose metabolism was relatively constant. And incidentally, this busts the myth that you can stimulate your metabolism simply by eating regularly. Initially, in the first few days, a lot of the excess carbohydrates was soaked up in the form of glycogen. It could be actually stored in muscle and a little bit in the liver. But as the glycogen stores became saturated, the excess glucose got turned into fat. De novo lipogenesis, literally making fat from sugar. Now, you probably know this fat by another name, as triglycerides. And experimental research shows that feeding carbohydrate increases saturated fats much more than consuming saturated fat itself. Very important point to understand. All right, question 11. Which of these plant proteins provides all 9 essential amino acids in quantities sufficient to meet human needs? Lentils, wheat, peanuts, and soy. The answer is soy. And this is one of the few plant proteins that provides all of the essential amino acids in near adequate amounts. Lentils are low in methionine, wheat is low in lysine, and peanuts are deficient in both. So soy protein is widely considered to be the most complete source of plant-based protein, although methionine is still a limiting amino acid. This study, for example, found that skim milk resulted in a 43% higher muscle protein synthesis rate than soy milk. So the fact is, most plant proteins are incomplete. And you also need to be familiar with something called protein complementation, which is if you have vegan or vegetarian patients, they need to combine plant proteins from different sources to achieve a more complete amino acid profile. Question 12. Which of these cannot be found in red meat? Taurine, genistein, creatine, and vitamin C. And the answer is B, genistein. This is an isoflavone that is found in soy protein, and it actually binds to estrogen receptors, and therefore it's got estrogenic activity, especially in states of low background estrogen, such as in a male or in a menopausal state. Now, this question, I really wrote this to make the point that red meat is nutritionally dense. There's a list of about a dozen nutrients that are either absent or deficient in plant foods, which are contained in red meat. So please don't just consider red meat to be a protein, which we often consider it. Please do consider it as a source of micronutrients as well. Now, you might be pondering the vitamin C option because everybody knows that red meat is deficient in vitamin C. And if you're looking at the USDA nutrient data for beef, you would see that indeed meat doesn't have any vitamin C. The thing is, this data was formulated without actually measuring vitamin C levels. They assumed it was zero and simply accepted it and repeated it without question. When it's actually tested, though, we find that red meat does contain vitamin C, which is no doubt what we would have predicted if we were students of history. So Arctic explorers for a long time have used fresh meat to treat scurvy, as did Napoleon's army during the 1801 siege of Alexandria, where they consumed horses who had perished in battle. Okay, question 13. Which of the below statements concerning anti-nutrients is incorrect? Now, many of you probably have never even heard of the term anti-nutrient. It sounds pseudoscientific, but it is absolutely an accepted concept. A, anti-nutrients contained within corn have been shown to completely inhibit absorption of zinc. Concurrent consumption of vitamin C can eliminate the impact of anti-nutrients. C, anti-nutrients such as phytates, tannins, and oxalates can reduce the bioavailability of minerals like iron, zinc, and calcium by binding to them in the gut. The low absorption of iron from legumes, approximately 1 to 2%, is primarily due to anti-nutrients. Anti-nutrients may impact the absorption of protein by forming insoluble complexes and inhibiting proteolytic enzymes. Now, the correct answer, I think I may have miswritten this question. So anti-nutrients within corn completely inhibit absorption of zinc. That is absolutely correct. Concurrent consumption of vitamin C can eliminate the impact of anti-nutrients. Well, no. So the correct answer here, or the incorrect answer, is actually B. So talking about why, let's have a look. This study fed subjects oysters and measured their zinc absorption. And you can see they managed to absorb a good amount of zinc, as you can see by the area under the curve. But when we fed them the same meal of oysters with black beans, we significantly attenuated the absorption of zinc. You can see it's probably down by 2/3. But look what happened when they were given corn. The absorption of zinc reduced to all but zero. This is the effect of anti-nutrients. These are compounds typically in plant foods that bind nutrients and prevent their limit their bioavailability for human digestion. As for iron, in the question we referred to iron having a bioavailability of 1 to 2%. This paper found that iron in 5 commonly consumed legumes, which it must be said are commonly recommended as a source of iron for vegetarians, was only 1 to 2%. So please have some awareness of these compounds within plant-based foods, phytates and tannins and oxalates and so on and so forth. These change the amount of nutrients that we can actually digest and absorb from food. So just because it says X milligrams of iron on the label doesn't mean that you're getting X milligrams of iron. Question 14. Which of the following is incorrect? Dehydration up to 3 to 4% in well-trained cyclists does not impair physical performance. Observational field data have reported dehydration levels of 6.6 to 11.7% body mass in male marathon winners. Observational research identifies most successful marathon runners drink fluids first. Maintaining body weight is an effective means of avoiding dehydration and improving exercise performance. Muscle glycogen depletion results in the release of bound water, a 3-to-1 ratio. That ratio that is listed there is incorrect, actually. That's meant to be 1 to 3. The electrolytes contained in sports medicine drinks are generally considered sufficient to prevent exercise-associated hyponatremia. And the correct answer here that I was actually looking for was D. Let's have a look at some really interesting studies on this. And the reason I've done this, I've been in many club rooms, elite level sports, where I've seen dietitians come up and put players on scales to make sure they haven't lost any body weight over the course of the game. Otherwise, they're dehydrated, and that's considered problematic and, going to affect their performance. And they're told to strictly hydrate. And we tell athletes to hydrate so their urine remains a light straw color, because anything that's approaching yellow is a proof of dehydration. And these are simply incorrect and bad practices. So, first of all, this meta-analysis concluded that up to 4% body weight dehydration didn't alter cycling performance. And this study was quite interesting. So they looked at 13 international marathons, and they looked at the weight loss in the winners. And the minimum body weight that they actually lost was 6.6%, which tends to suggest if you're not losing at least 5% of your body weight, you're probably not going to win a marathon, which is quite interesting. Now, understand that glycogen in the muscles, you are going to have some glycogen depletion, but as you deplete that glycogen, you're also going to lose some water. You're going to release water. So that is going to be an insensible loss that you can't control, but it's not the same as dehydration. So you're going to have a degree of body weight loss through that as well. And so essentially, if it's been shown that if you're not losing weight, you are at risk of exercise-associated hyponatremia as well. So there are consequences to doing this. Also, one of the points is that the job of the kidneys is to concentrate the urine. So we know that one of the first signs of kidney failure is loss of concentrating capacity. The kidneys want to concentrate. They want to give you yellow urine. They want to give you a highly osmolar urine. So we should let the kidneys just do their job and not try and interfere. If you've got healthy kidneys and you're drinking enough that your urine is light straw-coloured, as is often recommended or encouraged, you're basically overcoming your natural kidney function. So just be mindful that overhydration probably causes more problems or can cause significant problems. And drinking to thirst is a very good notion during athletic events. You reduce the risk of exercise-associated hyponatremia, and it also appears to be very consistent with good sporting performance.